Hello. Today we have a very important person with me. He is Dr. Dimitar Kolev, a very famous neurologist from Bulgaria, who is a specialist in multiple sclerosis as well as in autism. Had seen hundreds of patients in their country, and he is here in Ayush Prana to use a new device which is quite unknown in Indian subcontinent. This special device is taking a functional MRI equivalent images and can interpret the disease progress, the effect of a treatment, and what are the main triggers of their disease. These things are analyzed with this Loretta neuroimaging system. So we will try to ask few questions to enlighten about this software. Thank you, Dr. Dimitar Kolev. Can you give some idea about this special neuroimaging system?
Thanks, Dr. Prasanth. First of all, thanks for your invitation to come in your wonderful clinic and to see by my eyes what was done here and what you're continuing doing about the patient with MS. First of all, I would like to tell that I was impressed when the first time received your results with patient with MS last year on a conference which have been done in Bulgaria, and you were the speaker on this conference. I was shocked when I saw fully recovered patient with 6.5 TDSS score with a huge amount of debilitation, fully recovered in your clinic. I was really impressed. So, you know, that's why I decided to come and to get familiarized with all the things which we are doing here using Ayurvedic methodology. Regarding the neuroimaging which I'm using, actually this is a very useful tool, very effective. Without any side effect, very quickly to perform. It's very handy. It's not heavy. It's portable, and the results which can be reached are really similar with the results with fMRI devices, especially comparing the space resolution. Space resolution is probably the same like functional MRI, but even more, as Loretta QAG devices can reach the temporal resolution, which is much more higher than the functional MRI, which actually giving us opportunity to observe cognitive process, which is much more quicker, even less than 50 milliseconds. It's impossible for fMRI devices. With fMRI devices, we can observe a process in the brain, in brain networks, faster than 1 or 2 seconds, which is too slow for our perspective. So, using this device here, you actually saw that objectively we could verify all these good results which Ayurveda succeeds in treatment of neurodegenerative disorders, and especially multiple sclerosis.
And while referring to the Ayurveda treatment, what are the main benefits, or what are the extra treatment benefits what Ayurveda can bring in the treatment of neurodegenerative disorders like MS?
Probably it's hard to say. I think personally that in conventional medicine Regarding neurodegenerative disorders and especially MS, the approach is probably mistaken.
You mean the immunomodulatory treatment?
I mean immunomodulating, and especially the treatment with monoclonal antibody. The same is happened with the other neurodegenerative disorders, especially the Alzheimer's disease. Most of the researchers which working on this field can't able to prove that this treatment helps. It could be reach some kind of stopping the progression, but not fully recovering. As the Ayurveda, actually, it could be happen using Ayurvedic methodology and treatment. This knowledge, which is so ancient, 1,500 years before,
Right.
see,
right.
it's very intuitive. They have so simple, so common sensing, right approach to the human health, and actually seeing every day that it's working.
Right. And also, you see that since it uses mostly herbal resources, that the side effects are, among the patients you have seen, we did not see any unwanted side effects. So that's also an added.
Absolutely true. You showed me the way how all these oils, all these pills, all these treatments are prepared in the pharmaceutical department of the clinic. It could be seen. I suggest you that probably all the patient must see this process, because this is tremendous hard working process, and most of the herbs coming just from they are fresh, they're coming from the nature, and all these things is probably the guarantee that they working in the proper way.
One important thing, we are coming back to the device, and it's when we looked at many patients, you were telling that some of the doorway for the disease progress or cause of the disease could be the frontal lobe, which is related to immune system or infection related.
Yes.
Or in children with autism, that the tonsillitis that can also eventually. And the other area is like the gut related area, which is very important as we are dealing or we learn more about the gut microbiome. And also adding to that, the limbic system, where amygdala, these areas are affected, hypothalamus. So they are mostly to emotional disturbance. So that was very amazing that you can really see that distinguish. Can you put some?
Yeah, actually, I'm gathering this experience. I start to realize doing this functional neuroimaging that there is some logic, how to say, pathogenical logic in developing of this science, lesions in patients with MS, which is quite reasonable. First of all, I'm many times discussing with my colleagues why the lesions in MS usually starts from exactly the same areas in the brain, and no one of them could give me the reasonable explanation of that. What I reached to realize that this area in the brain, where the lesions actually in a patient with MS, is actually the most active from metabolic point of view and most blood supplied area. They consuming a couple of times more blood comparing with the other brain regions. And when there is a disruption of the blood-brain barrier and the blood is compromised from carrying different toxic dispatch proteins and different antigen properties, it's very common to expect that most blood supplied region of the brain will be most damaged. And that's how it's happened actually. That's why in this kind of disorders, MS apparently, our goal is to stop this process, to close the blood-brain barrier, and usually in an active state of disease, neurologists in conventional neurology doing this by using the steroids, but we both seen that this method which using here, Shirovasti, actually, because the steroids closing the blood-brain barrier, but Shirovasti, we see on the images that doing the same.
Yeah, that image we have seen before and after Shirovasti.
Yes.
That I understand you are very impressed by the.
I'm very impressed. I'm also experienced by myself these things that really it's working. It's really working because actually official medicine, I can't understand why official medicine reach to use only one gate to treat the patient orally with tablets.
Right.
90% of the patients in the Western medicine are treated by tablets.
Right.
In Ayurveda, you using the skin. Thermal penetration is a huge amount of impact. Penetration by skin. You using the rectal, so often the rectal
route is
methodology.
also
Rectal route is also very important. Different kind of treat of oral cavity, nose cavity, this kind of intervention.
Right.
A lot of approaches. It's amazing.
One very important tips for especially multiple sclerosis patients, what Dr. Kolev was telling is, when you have lesions in the frontal lobe, then you have to take care of your sinuses. Whether you have sinusitis, then that has to be cleared. You have seen hundreds of patients, there is a relation.
There is not only me. I've seen a lot of MRI images, and mostly of patients, they have some sign of chronic infection of the sinus cavities, but there is a statistic, there is a lot of articles which claim the same. 70% of the patients with MS have some kind of sinus infections. 70%.
70, that's a big number.
Most of the neurologists, unfortunately, though they don't make any
correlation
of all this comorbidity.
That's quite simple one, but left unnoticed.
Absolutely, it's so logical. It's a local, focal infection close to the brain.
And it's also one way that in Ayurveda they say that the nasal or nasal treatments are known to be influencing the brain, and it is told that the nasal cavity, through that you can approach the brain, you can influence the brain. The same way with the medicine, as well as a disease process can also get engaged.
We can go deeper. Even we can go deeper if I advance in Ayurveda medicine in the next month, probably. But we can speak here for different principles compounding the doshas.
Right.
You know how many air as a principle in the doshas
Right.
affect the doshas.
Correct.
Because one of the dosha, the vata, is compound from the air.
Right.
We are breathing air. We're consuming food.
Right.
So this is the two main impact of the nature over us.
Right.
Is the air which we're breathing and food which we're eating.
Yeah. Today you were explaining about the ama.
Ama.
The
Yes.
principle,
Yeah.
you know. So one very important you were telling related to the food intake and the evening food intake.
When I was a student, medical students, that impact how tremendous actually, how important is the food, preparation of food, how we eating food, when we eating food. In Ayurveda, I discovered, and I shared this discovery this morning with you, that ama actually is the toxic materials which body start to produce because of the lack of metabolic power, lack of enzymes producing from pancreas glands, intestinal and other intestinal glands. If we eating after specific time of the day, probably these glands, they shut down the process of producing.
Yeah, you mean
enzymes.
towards the night time or
After that time, whenever we, whatever we eating,
Right.
it's getting toxic for us, for our glands, for our digestions. So, in Western medicine, all these things a little bit are neglected.
Neglected.
Yeah.
Good. So, I mean, eventually, maybe in the future, you are looking forward to know more the
Absolutely.
Ayurvedic medicine and to try to integrate into Western medicine. And what do you think that such an integration is possible for
Absolutely
the
possible.
well-being of the patients?
Yes. Most of my discovery here is like revelations, enlightenment.
Right.
It's very valuable for me. It's very important. These things I've been searching for years, and this perfection of this mastering of the executing the process of treatment here is incomparable. So
Thank you.
really, I'm really impressed of your work, and of course I will try to apply all these things in my work, but mostly I'm looking forward to keep with you and to learn more and more in the field of Ayurvedic medicine.
Yeah, we are honored for that.
Everything was done with thoughts. I mean, it's obvious that it was thinking about how was built this place. Not only the treatment, not only for herbs, all this environment, all this cozy climate, all these small houses, this feeling of intimacy, these huge trees, this surrounding with the nature, with songs of the birds. All these things was done intentionally.
They are adding to the healing process.
They are adding to the healing process strongly, because we are not only body as mostly thinking on the in the Western world, and different specialties divided, and all of the specialists look at his field, don't care that we are actually the whole.
You are also telling that this Loretta device that you will be teaching other doctors in Europe. At the same time, if certain institutions, medical institutions are interested,
Yeah.
they can also join such a course
Yes.
to learn about the
Yes.
Loretta.
Yes. I'm going to do this when I come back in Bulgaria. There is also interest of this method in Bulgaria. It's quite new actually, but it's not newest because a lot of university in the United States using the Stanford University, they have a Loretta QAG and using in their researchers. Pennsylvania University, many universities in the United States using these effective methods. South Korea also.
But
Europe.
unfortunately, in India,
Unfortunately, I'm really surprised that there is no such a kind of tool in India. But
I have seen the list. It's a huge list
You see
from all over the world.
You
but,
saw the list?
Yeah. Right. Yes,
Yeah.
sure. In that,
Yeah.
India is missing.
Missing, yeah.
So this is a good opportunity. I will put the link to the Loretta device and his courses in future. So it's a good opportunity for doctors to learn.